people who are still going for surgery without having anything signed.
You think so?
I still believe so.
That?
Yes.
Oh, MRI. People die doing MRI.
You have to take your malaria test by taking your blood sample and running a test in the lab, and this needs to be done. Just like go ahead and do it without asking for what.
Why?
Informed consent should be comprehensive in the sense that people should be able to tell other people that this is everything that my treatment entails.
So they didn't tell you what's at risk. They didn't tell you how they are going to open you up, what they will remove, and how they will close you up, and what's going to happen days after. They need to let you know in languages. They didn't explain what MRI is for and what they are planning to do with MRI. Then she went to speak to someone that is uninformed, then told her the wrong thing, then gave her anxiety and scaring her and making her worried and all. When you talk about informed consent, most people think it's just a form they sign. Technically, it's not just a form, it's a process.
Hi everyone. Welcome to another episode on our podcast. We have a very interesting segment for today, I do believe.
It's juicy. I was just telling Oida earlier on about me shaving my beard, and before I was keeping a mustache.
I think he's going to tell us the genesis behind that.
I was keeping.
He has a reason.
I was keeping my mustache and shaved off my beard. I'm sure most of you except you are following on social media. You're following me on social media. That's the only time you see. But I shaved off my beard and kept my mustache.
Maybe people would want to see. Show them.
Yeah, we'll put a picture. We'll put a picture for you to see when I was growing my beard. So for those of you that don't know what I was trying to do, it's just me keeping my mustache and making a conversation starter for men's mental health awareness. So
which I'm very much in support of. Did I reshare?
Yeah, she's always like advocating about men doing better about talking about their health. She's always doing that. So
see, it is good to be fun in two things. I have such a very pitiful story. So imagine you having a child in the hospital and your child is sick. You think it is malaria, and then you just took your child to the hospital to be looked after. And then there come some people with their vaccinations. They said they have what it is required, or the medicine it needs, that is needed for your child to get better. So you agree as a parent, of course, you want your child to be better. And then with no knowledge of what the medicine will do, other than the promise of getting well or being better, the promise of sovereign. Do we call it sovereign? I mean, of course, it's just like, oh, you've been praying to God, somebody from above to heal your child, and somebody's coming with the promise. Of course, this is something you agree to do. But then come the cries, the shout, and then the loss of lives. Many people died, and such as is in the case of the Pfizer Kano of 1996 during the breakout of meningitis in Nigeria, the northern part of Nigeria. And this happened because of inadequate or lack of it at all, of a concept that we refer to as informed consent. I guess basically what we are going to talk about today is on informed consent.
Yes.
This rolls off of people's tongue. People just talk about informed consent as something insignificant. You go to the hospital, doctor tells you to do something, they're like, oh, you have to take your malaria test by taking your blood sample and running a test in the lab, and this needs to be done. Just like go ahead and do it without asking for what?
Why?
We are doing malaria, but exactly what test are you running for you to test for this malaria? Because I do, as well, an healthcare provider or professional, I know that when you run a particular blood test, you take just one tube of test, you are running more than one thing within that bottle, except that is exactly what you are going to run. So I think the doctors, they owe the patient, or all of us healthcare professionals, we owe them the duty of explanation of exactly what we are running within that blood test. But informed consent is a very big thing, which we'll get to in a minute. It is not just on blood test, Taiwo, if I'm right. I saw a video on social media, a very interesting one of a student nurse who was performing a last office.
I am going to explain the procedure to the dead body. Dead body.
You are explaining the procedure to the dead. Is he alive? Is the dead body alive?
I want to take the consent, ma. I am going to explain the procedure to the dead body. Dead body.
You are explaining the procedure to the dead body.
Yes, ma.
And he's listening to you.
Yes, ma. To take on the consent.
That's serious. Go ahead.
Dead body. I am a student nurse on practical, and I want to explain the procedure to you. In carry out your your last office. It's not me that dead you, ma. It's not me that find you.
So welcome back, everyone. Kai, what do you want to say about the video before we continue?
I mean, it's quite. I think the opinion is divided in as much as you want to respect the person, even though dead or alive.
Yeah.
Everybody deserves to be treated with dignity of respect.
Absolutely.
But I think we should leave it to our viewers to decide if they agree with what was done in the video or
We'll leave it to the viewers, but nonetheless, in nursing school, when you write your OSCE, you don't grade. You fail, you read, big S. But I mean, this is our opinion.
yeah.
Maybe some lecturers were not like that, but I do know some lecturers, some of them.
That we want you to grade the dead body.
Mr. Deadbody, Mrs. Deadbody. So, we want to talk about the definition of informed consent for everyone?
Yeah.
Yeah.
I mean, when you talk about informed consent, most people think it's just the form they sign.
Yeah.
And technically, it's not just a form, it's a process.
Yeah.
Informed consent, because I work in clinical trials, so I do research, and knowing that also, she did tell you about it though. She just started a new job. I think it's been a couple of months now.
Okay.
That she started a new job and she's now a clinical trial. I recruited her. So yeah, it's a process. So in clinical trials or research where we try new drugs or it might not necessarily be new drugs.
Yeah.
It might be old drugs tried for a new disease or something like that. So where we work, informed consent is a really big deal. And without informed consent, you are opening yourself. If you do something without consent taken, you're opening yourself to a big lawsuit and on your own for a while. So informed consent is a process whereby, in terms of the hospital now, you're about to do a procedure or a test or an intervention to a patient. You need to, or not necessarily a patient, it might come as an outpatient to a person or a patient, and you need to let them know what the
You have to have a conversation with
Yes, a conversation in a language, emphasis on a language that they will understand. It's not like someone is going for surgery now, maybe going for appendectomy, where they will remove the appendix.
Yeah.
Most of you know what appendix is. It's just an organ that you could live without. It's just adding.
People say it is useless, but I don't think it is.
Hey, it's just a vestige. People pick on appendix a lot. So you going for that surgery, and them telling you, oh, this is what's wrong with your child. Always go an appendicitis, and we need to remove it immediately. Sign here, and would have the surgery done.
Because they tell you, some doctors may even go to the point, sorry to cut into your brief, may go to the point to tell you, oh, it is useless anyways. Well, if you don't have it, there's no problem.
Point, this is not to attack anybody. We are not here to do.
Maybe I shouldn't mention a doctor.
No,
some professionals.
I mean,
okay. Because the surgeon, so doctors are always the surgeon.
Yeah, so I feel like if I seem like we are bashing, we are not bashing, we are just talking the truth here. We told you at the beginning of when we started our podcast, it will be a truth and facts only. So we are only saying it.
And sometimes the truth is bitter.
Yeah, we all need to
hard to chew.
Yeah, for us to reform the healthcare system, we need to be able to have an honest discussion. So if the doctor says, oh, sign it, we're just going to open you up, remove the appendix, and that's it. They didn't tell you how they're going to do it, the risk involved. They will put you to sleep with general anesthesia, and the risk involved with general anesthesia, the risk involved with your appendix that they want to remove.
Okay.
It could burst before they reach there. It could lead to sepsis, like overall infection all over your body. Sepsis is a great infection, like infection that is overwhelming to your body that can lead to multiple organ failure if you are not careful.
Yeah.
So they didn't tell you what's at risk. They didn't tell you how they are going to open you up, what they will remove, and how they will close you up, and what's going to happen days after. They need to like let you know in languages. Like the way I said, oh, we'll just make a decision, open it up, cauterize, and clamp the appendix, cut it off, excise it, and close your back.
Yeah, they need to tell you every step.
That language, do you understand? Like, if I speak
Right,
to
I
you,
understand because I'm
if I'm speaking that to a normal person, they just be looking like,
absolutely not. And we've seen people online go like doctors are talking rubbish and jargons. Of course, they say that to lighten the mood as a comic relief online, but nonetheless, it calls for concern. If you are talking to people about a treatment plan that they do not understand, we should actually be calling ourselves back as an healthcare professional. So people should be able to decode the treatment option.
yeah,
Everything entailed in the treatment. What can we do? Okay, this is the conformity, the conformed way that everybody has imbibed in following for the treatment plan.
Yeah.
Or just like chemotherapy, people know chemotherapy should be given intravenously. Some of them, and then exactly because maybe in the olden day or traditionally it used to be intravenous. Then some people did research and they found out that there were other better ways, or there could be other route of giving this chemotherapy. And now you just came around like intravenously. You need to tell people other ways that this could be given so that people can make their choice. If I'm not comfortable with this thing going intravenously, which other ways could it be done? Even at all, you could informed consent also give the people the benefit of saying, okay, this treatment option entirely, I don't want it. Even the treatment itself, not the way it is done or the steps involved. The treatment itself, I don't want. Which other treatment could I do?
exactly.
It gives that informed consent, gives the people the knowledge, entire knowledge, not just a brief knowledge or a summary of what should be done. It is comprehensive. Informed consent should be comprehensive in the sense that people should be able to tell other people that this is everything that my treatment entails. And if the treatment, if I don't want to do the treatment, it doesn't necessarily have to, because people are like, oh, you are going for surgery. Have they told you the consequences? It is either death or survival. What is this? What is the survival rate?
You know that reminds me.
Yeah.
My mom, I don't know if she want me to tell this story, but my mom, she was going for MRI. Then somebody told her that, MRI, I think it's the fault of the people that told her she was going for MRI. They're supposed to like involve, tell her like, oh, this is what the MRI is going to do. So the person told the doctor told my mom like, oh, you are going for MRI and we'll let you know when you are going to go for MRI. Then my mom was talking to a friend of ours, telling her that, oh, I'm going for MRI. Then our friend told her like, MRI. People die doing MRI. this is not a joking matter. I'm just like letting you know, like, and it's not like my mom is an illiterate. She's not an illiterate, but there are things that you say if you don't fully understand. Like when you say MRI, if I don't work in healthcare field and you tell me what an MRI is, I'll be like lost and I don't know what it is. So I didn't mean the doctor has taken time to explain what, and then my mom was worried that she was like, MRI. What's going to happen to me and my kids and all like that. So that kind of thing, like that example, they didn't explain what MRI is for and what they are planning to do with MRI. Then she went to speak to someone that is uninformed, then told her the wrong thing, then gave her anxiety and scaring her and making her worried and all. So I feel like that's an issue when you don't explain the process. Like informed consent.
When informed consent
is just said, oh, yeah, going for MRI. Yeah, just going for MRI, and that's it.
Yeah. So when informed consent is not properly followed, so what could go wrong is the fact that you are transferring autonomy onto people that do not have the knowledge of of the procedure. Even if you have a child, for example, I am informed, but nonetheless, my knowledge is not empirical. You could want to see a cardiac surgeon who wants to do something. Maybe they want to do a cardiac catheterization, or they want to do angiography. And then you came to me.
I think she like tone down the medical jargon.
It's a procedure whereby they do to see if there's any artery on your around your heart that is disease causing a particular problem or irregular heartbeat.
Thank you.
Or regular heart rate.
Thank you.
So now they want to do it, and then you may be surprised that a nurse who is in oncology, of course, does not know anything like that. Except they go on their Google or AI. AI will tell you empirical or the general knowledge of what this thing could be. Especially if we know exactly the benefits and what could go wrong within this thing. You come to me, although I'm informed, you think I'm informed because I'm the doctor. You are the son in the case of your mom. Your mom think you may be informed. This is not the case of MRI. It's, say, the case of angiography we are talking about. You broadly tell your mom the concept of what everything you know. I mean, oh, this is beneficial. We see patients who have doctors and nurses as children a lot, even radiographers. They tell us, oh, I'll wait for my son or my daughter to come back so I could discuss with them. It may be right, but to some extent, I actually always appreciate children who say they want to be there when these discussions are made, even though they are doctors. But they understand the limits of their knowledge. They want to be there so that they can understand. Because I understand. When you explain to me, I can better understand than my mom would. Then I can now explain better to my mom in a language that we understand because we are family.
That shouldn't be so, you know. That shouldn't be so.
It should be, informed consent should be something for patients alone.
The patient to understand. That's why I said.
But the children, in this case, this is a discussion. See, this is what informed consent can expose you to.
Yeah.
Because many people will leave the decision to their children. But in the cases that I've seen, the children also note the information down.
That's fine. That's fine.
They break the information down to what they believe their parents would understand. Because they know their parents more than we do.
Don't you think if you are going for, maybe now the patient came to the hospital, as the doctor or whoever, depending on what country or what you're from, there are sometimes in the UK that we are in, where nurses, they see nurses and nurses talk about procedures with patients. If you're coming to see a nurse or a doctor talking about procedures, and you are using language that the child has to like be breaking down for that, don't you think informed consent is lost?
So I guess we'll talk at some point. We'll talk about barriers to informed consent because this falls under a barrier. This may actually be pointing to different type of informed consent, and then to something also that we refer to as Mental Capacity Act. So because Mental Capacity Act, this is where you as the professional should be able to understand and know your patient better before you approach them. So Mental Capacity Act basically is a law that is enacted to protect patients and or maybe service users. So in the sense that you as the healthcare professional that is offering a service to the patient or to the consumer, you have to gauge the mental health or status of the patient or the consumer you're approaching. This is not by like asking them, are you normal or are you mad or you're not mad? Most definitely no. I know they are not going to ask if you're normal. So because I do believe everything we do.
Mama, you know, would you say you're normal or you're mad person?
So this is okay.
Let's get back into the podcast.
So, DJ, calm down.
All right, let's go.
So I think we'll take another episode when we talk about Mental Capacity Act, because this is actually a very, very broad topic. Ty will be serious. I'm being serious right here.
All right.
So, because we'll take another episode or another segment where we talk about Mental Capacity Act. But briefly, Mental Capacity Act is one whereby a healthcare professional who is licensed or to do this goes through the process. It's just like you going through an exam of reading ABC and then your patient being able to read the A to Z. So, and then you certify them as being certified. So now you follow some questionnaires, you solve from processes. There are series of questions or behavior that you see in your patient that have been listed into maybe questionnaire that you follow to establish your patient has been having mental capacity. And then briefly, this is what the test is. Is your patient 18 years and above? Of course, yes. Your patient that you're approaching for informed consent must be. Your patient, do they have any comorbidity of learning disability that could prevent them from having an understanding of what you want to discuss with them? So if there is no interference to them understanding what you want to discuss with them, yes, you're taking something under Mental Capacity Act. And then again, do they have the attention span for them to decode what you've given them, and then for them to retain the knowledge over the course of treatment plan?
Important.
It is very important before you do your informed consent. And then, of course, do they have the knowledge for them to understand what you break down for them in layman terms?
Very important.
Do they have the knowledge to, reiterate what you've told them back to you, and then for them to, for kind of like example, for them to tell other people, or for them to teach other people as some kind of education? So now, I think this should be enough for people to understand.
Yeah, so you were talking about,
Yeah.
before you started talking about the Mental Capacity Act,
Yeah.
informed consent comes in a variety of ways.
Oh.
There are written informed consent whereby
Yeah.
you sign,
Yeah.
and there is non-written, which is the verbal one, or you give a
Or
gesture. Implied, that's the right word, implied consent,
Yeah.
whereby you, maybe if I only give you injection now, the doctors, most times when you want to give injection, you don't bring out paper and the patient starts signing.
Yeah.
If the patient is with you and the nurse or the doctor has gone over
Yeah.
what the drug is going to do, how often the drug will be taken, and
Yeah.
why they're giving the drug,
Yeah.
and the side effects and risks and benefits involved with the drug. And now it's time that I want to, maybe let's say the drug it can only be given on the bottom, or maybe it's a low dose that can be given in the deltoid muscle. Before I get distracted, there's a video I saw whereby a patient was inserted like 8 or 9 injections
On what?
on the deltoid. And the deltoid was the muscle.
Were they removing and putting
No,
it?
together, like 8 or 6 together. The 1, 2, 3, the same time.
No, wait. They brought out 8 syringes.
Yes, and you don't.
8 syringes and went in with 8.
No, it was like 1, 2, 3, 4, 5, 6, 7, 8. They gave it like put everything at the same time. We're going to show you the video. Put everything at the same time and injected, and remove.
Did you leave their hand?
The data muscle is not really big. It can't accommodate a lot of things.
Even the biggest muscle in the body cannot accommodate that. When would you give 8 injections?
I don't know what's happening, So that's what I saw. So like that kind of scenario, if I only give you the injection now, if I only give you the injection,
Yeah.
then you turn your button. Then I said, oh, this is the button we'll keep. Then you remove your what's the name?
Yeah.
And then I asked you, do you want privacy while you remove your what's the name? Then you come back and I've made your bum exposed.
So
that means
you are ready for it.
you are ready for that.
Yeah.
So I don't need to bring the paper.
Absolutely.
But when it comes to some circumstances, let's say surgery, most times it's surgery, that you do need written informed consent.
Yeah.
Or maybe you want to take chemotherapy drugs, like interventional procedures like drugs or surgery.
Yeah.
You need to have informed consent that I've agreed for you to administer.
Because you mentioned
There are risks.
it is really sad that they are still doing a facadely archaic practice in our country. People are still going for surgery without having anything signed.
You think so?
I still believe
You
so.
said that?
Yes.
Yeah, that's fine.
Some private hospitals. I am very sure people should tell us their experience at home. Maybe I'm living up to my name, because when we started this show, I introduced myself as the one bringing all the teas. So I hope I've been living up to my expectation.
Yeah. So let's keep it to that segment. So
Great.
the implied one, and that's the implied one where you show your bum and I give you the injection.
Yeah.
Then there's the written one that you signed that I've understood the risk and the benefits.
Yeah.
And I choose to have these procedures done to me,
Yeah.
surgery or drugs.
Yeah.
Then there's another one there's another situation as a whole, whereby I know there are some countries, let's take an example of informed consent in the UK.
Yeah.
There's informed consent for children that their parent has to sign. And the funny thing is, like, when you're doing surgery for children in the UK, you have to explain the procedure to the child
And to the
the
parents
and to the
separately.
parent. The child has to understand what you are doing to them. I'm not saying someone that is tabula rasa or someone that is 0 to 18 months or something like that. I mean, like someone that is 4 or 5 that can retain a little bit of what you're saying.
Yeah.
So
maybe we say from 7 upwards.
yeah, so like you could say, oh, we are just going to make a decision and take out just a little bit. Then the child can repay after you, but you need to get the consent of the patient. But also the child, you have to treat them with respect. You can't just say, oh, because I've explained to your parents, I'm just going to put you on and have the surgery.
Yeah.
So you have to also explain to the child.
Which I believe is what happened in our society. Breaking. I don't think any child would come to say, "Oh, I know what they are doing."
But
Of course, it's my parent. My parents say. My parents say.
So they've got informed consent 1, 2, 3, and 4.
Yeah.
There's informed consent for different stages. There's informed consent for children, for the child to like understand that you've explained the procedure to the child and the parent.
I think before we go into the sub type of informed consent, briefly to recap, we have the written and then of course the implied informed consent. So for the soul of the explanation you gave on the written informed consent, I guess people need to know that the word is now developed. We are less contemporaneous in the sense that we are more technology vast than contemporaneous. Now we've seen in our society that what is operable is consent being signed online. Even the privacy, terms and condition of updates on phone, mobile phone and gadget, we don't read them anymore. We just like say, yes, I agree. It is some form of informed consent, because in many ways we complain online. It's like, oh they are spying on us, You've already said yes and signed yes to those things. When you are signing,
you have choice. If you don't say yes, then you won't
because
get
we don't read them.
Then you won't get the update if you don't say yes.
Exactly. But you could decide not to get the updates if you don't agree to these the terms and conditions. There are different forms of written informed consent. The one that comes electronically. But please read them before you sign. People just scroll. I've seen that happen many times. People just scroll, like they ask you are the doctor taking the informed consent? Because nurses shouldn't be doing that. If you are doing that, we should stop. The surgeon, whoever is doing the procedure, in this case, interventional. If you are the nurse is doing interventional procedure, of course, by all means, you should be the one taking the consent.
Have you ever seen a nurse take the informed consent?
Maybe especially advanced specialist nurses.
Yeah.
So if they are doing anything interventional, or midwives, they are going to do anything to take delivery, they can all as well take.
Did they sign informed consent for delivery?
Of course. Why should I do believe they should? This is a midwifery
I don't think so.
thing. Taiwo, have you seen the Sky News of the BBC inquiry into delivery in the UK, the one that has just been released this 2025 December?
Did they sign informed consent?
Oh my goodness! If they're not doing it, they should be doing it. There are lots of litigations now in midwifery. They found the practice entirely poor, despite the fact that I think or believe that midwives are doing their best, but that they said the practice is poor. Just to be frank, if they're not doing it, I do believe strongly that they should be doing it at this point.
Okay.
Yeah. So going back to it, people should not just be scrolling to sign consent electronically. If you are doing written but electronic.
Do people sign consent electronically in Nigeria?
We have Urake and all that. Are they not doing that already?
I didn't work there, so I don't know what they are doing.
They should be. I mean, they should be
But
doing that.
just for the common people that don't go to.
Okay, for the common people, maybe we may be actually shocked. We shouldn't be looking down on Nigeria.
I'm not looking down on Nigeria. I went to school in Nigeria.
Is Mr. Tellis as it is? Maybe it's just being factual.
Nigeria hospital. I'll be interested if you disagree with what I'm saying. I'm interested because I worked in UCH, and UCH is believed to be one of the best hospitals in Nigeria, if not the best hospital, and it's got specialist care or everything. But aside from that, they were still using paper informed consent. So that's what I'm saying. Like people use paper informed consent.
People will argue with you that you say
in the UK people use paper informed consent.
Okay, let's leave that. Please continue with your types of informed consent.
So people use paper informed consent even in the UK. There's advanced. Some hospitals you will be surprised that they're still using paper.
But luckily enough, maybe I've worked where they used where they are posh.
She used to work in private hospitals.
Even with the NHS that I work,
they are transitioning now.
In the NHS that I work, they transition from paper to electronic before I left.
See, that was couple like a year or 2 years ago. So it's not that Nigeria is not that far off.
Yeah, then we seem to be like behaving as if we're everywhere. So
All
I'm
right.
here to defend Nigeria today.
So there's informed consent 1, 2, 3, 4. There's one for a child for that you've explained to the child, you've explained to the parent. One for a normal, not a normal adult, like an adult that understands.
They have been certified with
Yeah.
MCA, having the right of mental capacity.
Yeah, they understand and they sign this informed consent that they understood the whole procedure.
Yeah.
And there's another one for adults that don't understand. Then they have to bring a witness with them when they come to the hospital. If the procedure is important, then the hospital provides someone that speaks on their behalf.
Yeah.
A licensed professional that can speak on their behalf and sign.
Yeah.
Then the final one is the emergency one, whereby if between life and death, we need to take this person to theater.
We are healthcare professionals.
They are John Doe or Jane Doe.
Yeah.
Male are John Does. If you don't know who they are, females are Jane Doe. So when you bring them to the hospital, they don't have any relative. You can't contact their relative or anything. You have to operate.
Yeah.
So the hospitals got like a committee there are some policies that hospitals have policies that the doctor that is seeing the person agrees that yes, I consent to this patient.
So you are making informed consent
on their behalf
as that is the right or the beneficial treatment option at that point.
And the patient is unconscious at this point.
Yeah.
The patient is unconscious, and there's a committee. The committee has to meet really quickly and discuss about the pros and cons of the procedures that they're about to do, if it's important or not. That's that. The next thing, what we were talking about before, took me to a point.
Okay.
Immunization.
Immunization
in Nigeria. That's like an example. That's a really good example for everybody to understand. Let's talk about something that happens,
everybody knows.
That everybody understands and happens every day.
I took immunizations many before while growing up.
Do you want to watch this video? Like, what's this video? Is this kids or?
Absolutely. Before people watch the video, which I really love so much, because Taiwo showed me that. You told me about it and I went to watch. It is entertaining. I think talking about part of informed consent. I don't know if this is operable in our society. Also making decisions on behalf of others. So there's this power of attorney. So for people who could not make an informed consent, they gave somebody in the family ahead before they get to that situation.
How many people like Nigeria?
Maybe some people will do. I mean, we have elites amongst us. We have.
Are we given?
This is a.
Are we done?
This is a podcast where we advocate for everyone. We cannot neglect the 1% of population where we target the 99%.
Only kid now.
100%. So back to the power of attorney. So they transfer their own right onto somebody within their family or maybe a friend or loved one to make decision for them. Also in healthcare, this person can be allowed to sign consent on their behalf.
There's a caveat to that. Like the person is incapacitated or unconscious, they can't make their own.
So the same rule that we say for the person that is signing will go through under Mental Capacity Act. Such a person with the power of attorney or the right of attorney should also be able to pass that Mental Capacity Act. Okay, let's go watch our video. We will be right back.
Eka 0 to 5 years. Alamambi o. Adẹ̀rí tá à ń pariwo látàárọ̀ ẹgbẹ́ ọmọ yín jáde ẹgbẹ́ ọ̀pá ọmọ tẹ́fẹ́ jẹ wọ́n ni.
Ẹjọ́ ma èmi ò ní ìdí ọmọ mi ò ní ìdí.
Ọmọ yín ò ní ìdí ẹ̀. Báwo lọ́mọ yín jẹ́ ní ìdí ẹ̀ ó ń fọmọ dédé à.
Ẹ jẹ́ kí n lọ sọ fún bàbá ẹ̀.
Ẹ jẹ́ ìgbé mo wọ́n sẹ́ńtà ẹ̀ sọ fún bàbá ẹ̀ kàtó fọmọ booster.
Ọmọ yìí ní ìdí ẹ̀ máa fún un.
Ó ní ìdí ẹ̀. Àtọ́wọ́gbọ̀ kiri jáde kiri náà.
Ẹ má bínú.
Lẹ́yìn náà ṣe kiri báyìí fún. Ẹ jẹ́ fún ẹ lẹ́yìn booster ni.
Hello, open your mouth.
Ó ti da.
That's a fine girl.
Ẹ jẹ́ nǹkan kiri fún ẹ bá ń gbélé ìdání.
Ẹ bá máa ọwọ́ ẹ̀.
Ǹjẹ́ màá máa kí ọwọ́ ẹ̀. Ó yá àti máa kí ẹ. Ó ti gbà lẹ́yìn. Kò sí wàhálà má wọ̀rí. Ó máa ń jẹ́ kọ́mọ lókun ni.
Gbẹ̀dẹ̀ booster na energy booster lélẹ̀.
Energy booster ni.
Sẹ́wọ́n ti gbẹ̀dẹ̀ máa ti rọ́wọ́ ẹ̀. Bá ti mọ̀ pa ti ṣiṣẹ́ débi báyìí.
Ẹ káàsán. Ṣé ọmọ yín ti gbà?
Ọmọ mi ò gbà ó. Tó ní ìfẹ́ jẹ́ kó gba abẹ́rẹ́.
Ẹ máa fún. Ẹ fẹ́ jẹ́ kó gba abẹ́rẹ́ kẹ̀.
Ẹ máa fún.
Ọmọ yóò ṣe ní gba abẹ́rẹ́.
Ẹ máa fún torí gbogbo tó nǹkan ìjọba ń ṣe fún wa.
Gbogbo nǹkan tí ìjọba ṣe kí ni ìjọba ṣe fún yín? Kí ni kọ́mọ bá gba abẹ́rẹ́ àjẹsára?
Fi sílẹ̀ máa fún.
Kí kọ́mọ bá gbẹ̀gẹ́ ẹjọ́ ọ̀sẹ̀ pọ́pẹ́ yìí jù. Ó pọ́pẹ́ yìí jù. Kí wọ́n fún ta ni? Ọmọ yẹn gba abẹ́rẹ́ àjẹsára jù. Ẹ bọ́lẹ̀. Kò ní gbà kí ni? Kò ní gbà kí ni? Ẹ fún mi lọ́dọ̀ ẹ̀ jáde.
Ọmọ mi ò gbà.
Wọ́n ní kákìrì.
Ó máa gbà.
Agbábẹ́rẹ́ àjẹsára yẹn.
Ẹ má fọmọ tèmi o.
Agbábẹ́rẹ́ àjẹsára yẹn. Ẹ má jà.
Ó máa
Kí ló fún yà? Kò ní kákìrì. Ó pọ́ mọ́ yín jù. Ìjọba ní ká fáwọn ọmọdé ẹgbẹ́ gbódùbù sàmẹ́ ká bá fún wọn. Ẹ já lọ. Ó pọ́ mọ́ yín.
àti gbọ́.
Sorry, everyone. I think I've been laughing along with Taiwo. I do believe when people watch this, they must have been laughing. If you've seen the video before, pretend you did not. Laugh again with me.
There, like, there's a proverb, yeah, Yoruba proverb. I'm going to say in English.
Yeah.
I'll say in Yoruba first, then say in English.
Yeah.
So, like, something is past crying, you start laughing.
It's beyond laughter.
Yes, beyond
Laughter.
No, beyond crying,
right?
laugh. So this video, like you've all seen,
Yeah.
me and you, maybe a victim,
Yeah.
or we've been unfortunate. Not let me say unfortunate. We've been a victim of this scenario whereby there's a national program rolled out by the government. Then you see people that have been trained on giving injection,
Absolutely.
and just come to maybe our place or community or where we live and say, oh, bring out your children, bring out your children for immunization.
It will even be the head of the family or the head of the houses that will be running around kids. Mommy.
But you know, that's community mobilization, which is really good. But that's not what we're talking about.
We should actually talk about it because only on my agenda, I have few recurring issues in Nigeria, which are related to this immunization thing that we
Let's
watch.
use this immunization to
educate ourselves on informed consent. I said we have low health literacy. And you'll be surprised that people that are even educated, they have this illiteracy, health illiteracy in Nigeria. And then a lot of people, we don't even understand medical terminologies. How do you expect them to understand what this thing is for? In the case of this immunization that you watch, it's like, bring out your children, want to give them immunization.
How many of the people that is given immunization
or even understand what they are given?
When they do the training for them. I think the training,
so many problems.
Most times when they do the training, these people are not licensed health professionals.
Yeah.
Some of them might be allied health professionals that just took on the training and doing that.
I remember from the organogram of healthcare, CHIOs or the CHOs, they are majorly or mainly the people that aid immunization. They may have a nurse attached, but you will never see the nurses working with them. Maybe this is how to educate people again that nurses are not part of the people that go around giving immunizations because
there are some nurses involved. I've got friends that have done it as nurses.
Well, I have seen people do UCH. That is high-level kind of immunization, but the ones that run...
No, they run around. I'm serious. I've got friends that after they finish nursing...
Maybe one of them.
New nurses. Yeah, it's not...
They are the only one nurse that run with these people. They may not even be part of people giving the injection. They give the injection.
It's just because of money. That's all they got.
Did they give injection?
They gave the injection.
Supervising people.
They gave injection.
Oh, that's beautiful.
They got paid for it though. Or they didn't get paid.
Of course, even if they supervise people, they will get paid.
Yeah, so they just went around because they couldn't find a job, so they went around. They got the training, went around immunizing, vaccinating everybody.
Yeah.
But my own point is, most of these people, that's why I didn't say all of them.
She's one of many that understand what they are doing.
What they are doing, but not everybody understands why they are giving the injection. So you are actually right about
and then. Culture and family influence. This is what I said it is on my agenda because culturally, in Yoruba, our forefathers they believe so much in the white people and the benefits that they've given us. Of course,
like slave trade.
that is one of the negativities. But I'm so sorry if this is a touchy. This is actually a very touchy topic for me too because slave trade is a huge thing, but we are not here today to discuss that. Time. Let us focus. I don't want to offend any part of any part of demography in Nigeria, even not even my fellow Yoruba. So the thing is that I said that because they believe that vaccinations have done more harm than good. Some people do. Are you anti-vax, Taiwo? Are you anti-vax? When you said
I mean,
you don't believe in vaccinations, or you believe vaccinations have done more bad than good?
I'm not of that opinion.
Defend yourself.
But when I am talking about vaccines, so let's go.
Let's just imagine. This is the thing. The same way our people at home have reservations. It's the same way healthcare providers have reservations.
I mean, I do have, to be honest, let's even get to it.
Even though it's informed.
I do have my reservations about vaccines.
So we shouldn't use the word that their vaccinations. Well, that is why I said, Kaiwo, That is why I said cultural and family influence. Culturally, some people believe, even within the same Yoruba, let's use Yoruba as an example. The same way some people, amongst even the white people, if the whites, some of them are anti-facts, while some people are pro-facts. I
But
don't
don't
want
say
to.
white people, you say Caucasian. That's the
Okay,
politically correct term.
Caucasian. Oh my goodness, so many things are going wrong in the world. I mean, why do I need to be penalized for this kind of a thing?
What I want to say to defend myself, I'm not anti-vax.
Yeah.
When I say I've got my reservations about
Yeah.
vaccines, my reservation is during COVID, when they were like, oh, you can't get a job without getting vaccinated,
Yeah.
and you have to provide that. That's where I've got my reservation.
I actually have a very big story to tell you about vaccination. Taiwo, don't jump the gun.
Okay.
Relax. Take a deep breath. So now back to our culture and family influence. So some families and some head of the family, they believe that anything that comes from the government should be given to the children. So just like you said, even if children are running away, the most elderly man in the family or the male presence, because this is our community, the male presence in the community or the female
Do
presence.
you really think it's male? I
Or
think
the
most
female
times it's the
presence.
female.
Or maybe that is it, another thing again.
Most times it's the female.
That's what communities are diverse. You may see in some communities it will be like the elderly women in the house that will carry the children out. But where I've seen, or maybe the site where I came from, it will be the men that are driving the children out to have the vaccines. And in some other communities within the same locality that I grew up from, both of them. So now family influence, because my daddy, we are very limited in my family, but let's use my family as an example. My daddy has some children in the past, maybe let's say people who are elder than I am, who have had vaccines and nothing happened to them. Of course, they would want me to have the same vaccines.
Sure.
So it's just a family influence. And then again, people who did not have COVID because they had somebody that had COVID vaccines and something happened to them. Of course, you wouldn't want to have the same vaccine. We are using immunization in this regard. For informed consent, of course. So let's use the example of informed consent. You are undergoing a procedure, or because we do clinical trials. Somebody has been involved in a research study before, and something bad happened along the way, or their experience was not really palatable, was not really good. Because of that, their experience, I, as a family member, would I want to do any other research, even though it is not within the same topic? I wouldn't want to, right? So these are the things that affect informed consent, because somebody has done something else that is entirely different, even if it is the same thing. People morphology and biologics are different, and then our experience or exposure to things, we react differently. The same way you may be able to eat okra. You may be surprised that
I don't like okra.
I know a twin before that the Taiwo could not eat okra, while the Ken, they loved okra so much. See, morphology is different. And I saw a post sometimes on Twitter.
Turn down your medical. What's morphology?
Oh my
Your
goodness.
makeup.
Okay, makeup. So what our body,
Informed consent.
the water.
Language people will understand.
Our body is made up of water,
Yeah.
blood, plasma. Let's not go to plasma. Different things that like Maggi, salt, and everything that we used to cook are still the same way our bodies make up. The salt you use to cook this egg, to fry your egg, if you use salt for your egg, it's not the same salt you use to cook your okra. It's not the same salt you use to cook your jollof rice. Same like that. People are breathed differently. That is why some are short, some are tall, some are on the plumpy side, as well as some are on the skinny side. It doesn't make us wrong.
No, it doesn't.
So it's just how we are made up. So now to something else, we say doctor knows best culture as one of the actually leading thing that is causing informed consent to go wrong.
True though.
Example in the immunization we work, because the immunizers, they know best. That the fathers, mothers, they are like taking their children, go have it. Of course, because they are giving everybody, they know it is safe. This is why they are giving us. Don't assume that we know everything. Ask questions. Why? Like you explained to us. What for? If we don't take it, what else can we do? Alternatives. What is the consequence? What are the side effects or adverse effects? People need to know. Doctors do not know best. If they tell you, they know, they know this is the best thing for you to have at that particular point.
But should you as a Muslim, healthcare professional, be giving your opinion?
Oh, you give them in
Is
scientific.
your opinion you give?
Scientific options, not opinion. Scientific options available for that treatment or for that condition, not opinion that you think is the best.
I do remember in school when you're giving someone you're giving a medical advice or a nursing advice.
Yeah.
You don't put your own opinion.
Absolutely.
And what you're saying, you just tell them.
You know, a topic
facts.
that went online recently about a woman that was undergoing cancer treatment. And then people were saying, oh, she should not be having blood transfusion. She doesn't want to have blood transfusion. I think we talked about that in the last episode. People should go watch. Very interesting one, by the way. Yeah, that she doesn't want to have blood transfusion because, of course, she has cancer going on. And
I didn't see that though.
on Twitter.
I mean,
This famous woman on Twitter that has cancer.
that she shouldn't
Jehovah's
be.
Witness.
Oh, because she can't have blood because she's Jehovah's
Exactly.
Witness. So.
So now people are like putting their opinion. I was very surprised and shocked to see healthcare professional also bashing at that.
I mean, it's online.
So it's online.
They could say whatever you want, online. But you can't if you're a nurse or a doctor because you have
we are in a way where online there is an interference or there is some kind of collision between online.
Anything you say online.
Stop people. Exactly. You're saying it is online. Whatever you say online can be used against you in the court of law.
Yeah.
There's collision now between what is online and in real life. People believe online is not real life, so people behave anyhow. So don't be surprised. You will be held accountable for what you say online.
Nigeria has cyber bullying, cyber crime acts now.
So I guess the big one you touched earlier on was on language barrier. So do you want to talk more about that?
Yeah, like the story I was given, like appendectomy, I was saying appendectomy, inside, cauterize, suturing and closing, chloroprepane, draping, and all that medical jargon that we normally say in healthcare for each other to understand. But if I go to, let's assume what's name now, you know nothing about healthcare, and I'm telling you when I incise, I cauterize some of the minor blood vessels, then I remove it by excising it. And when I want to close, I pour antibiotics into the wound, shake it.
Even though we are speaking the same English, it's still jargon.
Then drain it. Suction out the remaining blood and fluid. Then when I'm done, I dry it. Then I close up by suturing. I'm going to use it.
We are going to give you some five courses of antibiotics to make everything go down. What 5 courses of antibiotics? What is that?
Then I'm going to, when you want to put it to sleep, we'll give you propofol. Come back. If I don't understand anything, why are you giving me propofol? And why are you giving me all this? These are the questions that will be coming. But because of the pre-notion that we have that, doctors know best. If he's telling me this, he must know best.
People don't even question.
And he didn't use a language I understood. Then when I go home, then I'll be like, they said I'm going to have surgery. They said they will cut away some part of my body. And they said it's very important. I don't really understand how it's going to go, but the doctor said this is it, and this is the best option. Is that the best option?
Absolutely.
If he didn't because the National Health Act, I think it's 2010. I can't remember the National Act that said this. If a patient is going for procedure, they have the right to determine what is best for their health. Yeah. I don't really want to go much into that, but they have the right to determine what's best for their health. Not you, not their husband, not their wife. The patient has the right. Yeah, let's the main story.
Before I talk about this Pfizer story of Kano of 1996 to language barrier, I guess I saw a video. Maybe do people want to watch again?
What video is that?
Yeah. So I showed you. I talked to you about when we're having this brief meeting that this lady from the southeastern part of Nigeria went to Lagos to work with Lagos State Hospital.
Yeah.
And then she was communicating with Yoruba. Of course, majority of people there, they are Yoruba speakers. She cannot speak Yoruba. She was trying to communicate in language that they understand. And then she was communicating to these people in a funny way, trying so hard to communicate so that people could understand. I believe that Nigeria should have, it's at this point, people should have interpreters. We should just not assume that because you are working in a state, you should go and learn the language. I don't see myself learning Igbo within a week or two, honestly, if I were to find myself in southeastern part of Nigeria to work. So things like this should be inculcated into informed consent as well.
That's
barriers.
that's the main. That's the main was name. I think, in like we said in the definition, a language
that
someone
people
has to
understand. So language barrier is actually a very, very big thing that you've touched. Yeah.
Then I think we should actually take people on the journey back to 1996 in Kano that actually made us want to talk about this topic, and we think it's germane for the public to understand the purpose and why informed consent is important, and why they have to understand informed consent. So in 1996, we're gonna take you the journey together in 1996, Kano. Whereby there was an outbreak of meningitis, and a lot of fathers and mothers, the family was thrown into disarray about children having meningitis. There was nobody to turn to. This is where Pfizer, a big American company, came into the country offering the magical drug called Trovan. Meanwhile, this Trovan has not been approved by the FDA, the Federal Drug Administration in the US. While they came to Nigeria, they saw an opportunity in Nigeria to try to prove that the drug works. They made falsified documents saying the Nigerian Ethics Committee, the health regulator in Nigeria, gave them approval to try this drug without offering any informed consent to the families to let them know this is a trial drug, and this drug, there will be an interventional arm, there will be a control arm. They randomize patients, children, not patients now. Let's say it as is. They offer children drugs, they put them in control arm, while they put some in the interventional arm. The drug, although they gave in the control arm, they gave them a minute low dose of this drug, while in the interventional arm, they gave them the actual dose for this drug. Then, fast forward a couple of days later, some of these children started having adverse reaction to this drug, whereby there was reported cases of about 3 people dying or 2 people dying, while some other cases, their life was thrown into disarray, whereby they have permanent brain damage, where they have to live with disabilities throughout their lives. And some people, they had deformities, whereby they were physically deformed. Their growth was stunted, while some other people, they lost complete function of their legs, and some had learning disabilities. Then the government of Kano, there's a case online, Kano v. Pfizer, where they charged the US company to court. There was pressure on the Attorney General of Nigeria then by some people, allegedly by some people, that they pressurized the government of Nigeria into settling 75 million naira. I think it was a million.
It was billion.
Billion, 75 billion US dollars. My question is, and settle with the parents, they will compensate each of the parents.
Which I believe were not paid until today.
Yeah, they compensated some of the parents with 175,000 US dollars, which some claim they only received 7,000 US dollars. There'll be a link attached to this video where you could watch this story, which is quite emotional, and you could watch this story about that. My question is, where's the money that was paid to the government? What did the government do to the money? Did they offer the money to the victims? And also the money promised by Pfizer to these parents, who did they pay it to? Because there's an interview where the parents said they didn't get claimed, and they had to take care of children with learning disability, mentally challenged children. And it's quite, I've seen having a mentally challenged children, or the correct political term, learning disability, whereby you have to take care of this child. One of the parents has to stop working to food, because they require like a holistic care and full-time 24/7 caregiver, which is taxing emotionally and physically and financially to the parent. So who did they pay to? The question to Kano State government: where's the money? Who received the money?
I guess my biggest concern, sorry to cut you short, is how was this company Pfizer able to get in contact with the children in the first place? If there were proper protocol in place by the government, this wouldn't have happened.
Yeah, this actually led to reforms in Nigeria healthcare, the National Health Regulatory Agency, than the National Health Regulatory Ethics Committee in Nigeria. This led to a reform. I think it was 2000, which led to a reform after the investigation and saw how porous the healthcare was. And this, on the part of the patient of the nation, this led to a mistrust of the healthcare system. And on part of the government, this led to a reform which was implemented, whereby for you to conduct the clinical trials in Nigeria, there are some structures and loops or hoops, not structure, or not loops, hoops to jump through to ensure this is not repeated in the country. So, you were sharing some story about what happened in the UK and how the UK also, because it's not only in Nigeria, this happened. You were sharing a story about
this also,
the UK.
This is the same line of thought, because this also led to the enactment of the Human Tissue Act.
Yeah.
So what basically happened in the UK is the same thing. People's body parts were taken for research.
Is he dead or alive, people?
Alive, nails, blood, but tissues from biopsies. It's like this is something wrong with the children. They tell
What
the
are
parents.
biopsies? So
Biopsies are maybe like
we need to.
biopsies are tests that are done to see if there are any cancer cells within where the.
How do they do biopsy?
So biopsies are done, for example, if somebody has, if it's been queried to have a liver cancer or kidney cancer, you go into maybe many theater, they go there. It is not invasive. They have a way of, it is mildly invasive, but still invasive, like they made some kind of where they take a little bit out of your kidney or liver just to test if there's any cancer of that. We call it tissue because it is not the entire organ. They are just taking a part, a small part out of that organ to test if there's any cancer cells in that. So they found out that those children from then adult, they were taking their body part.
Dead and alive. Wow.
To do research, to conduct research without telling those people. So there was no informed consent at all. So this led to opera within the UK. Different paper were taking this lawsuit. The
UK media, man. I know.
So many opera. So, and then sadly enough, I think come again 2013 or 2010, something happened again within London, some big NHS. So it led to the reform of the Act. This is why there is a human tissue capacity association.
Act,
yeah. So not the Act again, the reform. So that watch organizations, healthcare institutions, that the Act is being followed and the Act is being enacted. This is why it is important for everyone that deals with human parts to be trained for that, so that the case will not repeat itself again. So
that's sad.
Of course, even the dead body were not spared. Taiwo, thank you for that educative and an enlightening story.
Thank you. Yes.
Okay. Then we've touched every necessary segment on informed consent. We've defined informed consent for the people. We've told them the different types of informed consent and then what could go wrong, like barriers to informed consent. We've told them, and then our beautiful story. This is practically taking us gradually towards the end of the episode. But before we learn, we have to leave people with advice for the patient, for general people, on what to do when they are faced with difficulties or for in situations where informed consent is compromised. If you are the one, or you have loved ones that are being taken care of within the hospital wards, or they are undergoing any health treatment, whether outside or inside the hospital, ask questions. Will be my first advice to people. Ask questions. Do not just assume, or do not be afraid to ask questions. People have this fear of asking doctors questions. I don't know why. Or even nurses. Because the elderly nurses, people don't really ask them questions much.
Maybe they believe they are experts, like you said.
No. Ask questions, please. Me personally, and actually every healthcare professional should actually appreciate being asked questions, because
ego. If you've got big ego, if I tell you something and you are questioning me, asking, I'm sure. Like an example, when my dad was sick, then a doctor came to, because home treatments came to, not to like sound privileged or anything, but came home to treat him and had a variety of really powerful antibiotics to give him. Then I was like, these antibiotics are really powerful. I'm concerned about kidney and liver function.
Yeah.
Then I was like asking him some questions. Then he was like, he feels. Then I was like, are you sure about all these things? And I was asking him like, are you sure you're a medical doctor? I think we've had this conversation before about asking people about their qualifications.
Yeah.
Then he got offended when I started like asking him questions about this. Then I was like, I'm asking you these questions because it's our right to know who you are and why you're given this.
Yeah.
You don't need to feel. Then it was crazy. Like my dad had to say, oh, enough Taiwo and all.
Oh
my
my
mom had to call me like
This
I
is
was
part of my
disrespectful.
this is part of my advice to people. If anybody refuse that, know that you have a right to say no. In that case, there was interference from culture and family influence that we've explained on this informed.
But the
consent.
person is actually like a licensed medical doctor.
License, but you have to explain.
But the
comes
ego
in play.
got in way because he was.
I already told Taiwo that we should have a segment where we yarn ourselves as healthcare professionals. Honestly, it's many of us constitute nuisance.
We should do that. Yeah.
Many of us will constitute nuisance in the name of ego.
But do you really think it's nuisance? Because you might be thinking that, this guy, because I told him like I'm a nurse and all, you might be feeling like, let me say in Yoruba, nurse last one. A bloody, let me say in English, a bloody nurse.
So what would this doctor
think?
So what would this
years in practice.
What would this doctor now think of somebody that did not pass through the world of nursing school or medical school?
Hey, imagine, like, I'm a nurse and I'm asking.
It's still nuisance to me.
I might be thinking that bloody nurses asking me, what do they know? I mean, there's people saying, what do nurses know? There's been online.
I saw one medical student recently that said a doctor he does not care about pharmacists going on strike, that he can just carry his MDEX and BNF and prescribe. That is not that.
Let's move on.
Let's move on.
Don't let us
Again, my advice to people: request explanation, ask questions, and of course, know that you have a right to say no. That is my second advice.
Yes.
Say no when you are not sure, and then ask for translator if needed. I think we have this habit of assuming for people, thinking for them. Because in the video that I told you that I saw, so the lady was like saying the Yoruba. It was very hard for her, and the patient she was talking was like putting words into the nurse mouth. And she was like, yeah. I was like, oh my goodness, that is how we miscommunicate most times in hospitals. And then that patient, when she got something, a health service that she was not comfortable with, she goes back home to blame the nurse. Whereby
they will come online and say nurses are the worst.
We shouldn't put ourselves in situations where, as healthcare professionals now, where we are the ones we allow patients or the consumers to decide for us, to answer questions for us. We should be the one. If there's a communication gap, get a colleague. If there's no translator, get another colleague that could speak the same language. So it's very, very important. And lastly, do not rush to sign any form. I told people earlier, don't just scroll from the first on your phone or laptop or iPad and just.
Doctors know best, nurses know best. That's what they do.
Just sign. Don't be fast to sign any consent. Please. Lives have been lost. Litigations have been, lost because as a result of this. You signed for it already.
You know, every day I saw
What?
a man claiming the hospital stole his kidney.
How?
It might be like the kidney is diseased and they told him, we're going to remove this kidney and leave the other one there.
Yeah.
But maybe he's unaware of that. I mean, you rarely see, maybe he's got cancer. I don't really know what happened there.
Yeah.
But that's the form of whereby, like, saying before you sign anything, always know what they are going to do. Maybe they are going to remove your kidney and leave one and say, we are leaving only one. And you were not listening. And healthcare workers, there was a program we had with patients. It's called PPIE, where you involve patients in their own care.
Yeah.
You listen to patients. So one of the patients said, when they come to the hospital, because I work in oncology, cancer care, and the patient was like, when I come to hospital, most times, and when you start speaking, you give us the news about their diagnosis, their brain shuts off. And this is a lesson for the healthcare workers and healthcare professionals.
This is why you should give it.
It should be an ongoing process, like we said. It's an ongoing process, not just when they sign the form and that's done. You should always, even on day of surgery, like you go through the consent again. And that's why most times they say, when a patient sign informed consent for 7 days, it's past 7 days, when they come back for the procedure, maybe the
So
procedure was
right.
delayed, take it all over again.
And then to add to what you
Yeah.
said, people should be given the ample time to decide on the informed consent, even at least. But if it is not emergency, give people 1 to 2 days to decide.
Very important.
Let them chew over it, sleep over it, and then for them to come back and say, "Oh, I want it." You may be surprised. Somebody that said yes today could say no tomorrow.
Which is perfectly fine.
Yeah.
It's their life. They've got right to choose over their body.
So because now they understand better, they've
Yeah.
gone home to think over it. They thought about the consequences. They relate the consequences to their lifestyle or their life choices or the impact on their family,
life.
and they see that the negative outweighs the positive, and they're just like, no, and that is perfect. Give the people to decide.
Do no harm.
So
Maleficence, autonomy, what when we're doing ethics, we all did ethics. I want to believe all healthcare professionals did ethics.
no maleficent, not to do any bad, benevolent, to do good, and not to be judgmental.
So yeah, I think that's very
Sadly, many
important.
people are judgmental online these days. Healthcare professionals inclusive. Oh, thank
Oh
you.
yeah, that's like people. You see people online saying, "Oh, when I was giving birth, the midwives or the nurses were saying, when you were doing the do,
Was I
there?"
I think we should close
That's terrible. That's a terrible thing to say to someone.
I think we should close our segment today on this one for people to go and chill out. So if you see any healthcare professional do that,
That's
challenge
horrible.
them.
I feel like that's just horrible thing to say.
So know that you have a right. Maybe people should go back to the right we discussed on the
We
last
said
episode to see. Yeah,
to
nobody.
sue. So you should sue people. These are
Sue them.
things to sue people on.
Oh, Taiwo, thank you again
Yeah.
for taking us
Do you
on
want to
that
give a
musical
recap?
round. Yeah. On today's episode, I particularly have learned, and then I enjoyed it so much. And I also feel kind of emotional at some point.
Oh yes,
Especially on the Pfizer case. So again, we've defined informed consent. Informed consent basically is just like a conversation you have with your healthcare professional
In the
language that you understand, and then by giving you ample time for you to digest what is discussed with you before you say yes or before you make a decision. So you should know the treatment plan, steps involved, alternatives to that treatment plan.
Yes.
Before you can decide. This is what is composed of informed consent. Taiwo has given us the types of informed consent, the implied, and then the written, and of course the sub ones that involved people with special needs, children, people with learning disabilities, or people with power of attorney.
Yeah.
And of course, we went on to define the barriers to informed consent and what could go wrong. We've discussed with you today cultural and family influence, language barrier, which is the main thing in here. And of course, I would actually advise everyone to go on the Pfizer.
The story that was shared, the Pfizer story, the interview was quite emotional.
I actually did not know about it. I know there was a case of meningitis breakout the same year I was born, but then not that I ever went through the video. No,
You actually know there's a lot of things that I'm not saying this because I'm black, but I feel like black people, because in my trust or my department, we are trying to. Sorry, I know we are closing up, but in my department, we are trying to see why the people from global minorities, or is it majority? I'm trying to be politically correct, but it's quite hard sometimes. The global minority, why they don't want to participate in clinical trials. And we're trying to see the problem, like why not? And these are the stories why people don't trust.
Allegedly, in South Africa, it is believed that a big pharmaceutical company again introduced HIV to people.
Allegedly,
you would hardly see any South African submit themselves for any clinical trial. It's happened before, actually. The NHS where I first worked after moving here, blatantly refused.
Story in the US also.
And it was on diabetes. They were saying, "Don't eat this. No, I will do what I want."
So, I'm not saying you should go and be mistrusted.
Exactly. Lack of informed consent leads to a lot of damaging consequences, and which leads to people losing their trust in healthcare professionals and the healthcare system in itself.
Did you see the story? I'm just going to talk about some of the stories. The story about, I think it's gonorrhea or syphilis in the US, where black men, syphilis was tested on them,
subject.
And black women, all these advances,
even cholera outbreak, we were there.
The advances in the obstetrics and gynecological field,
Yeah.
there are black women that were used that they operated on them without anesthesia. I don't people
It's still
don't
happening
understand.
until this year because there are videos flying around
Oh,
that
really?
the black minorities in America, that when they go for
Oh yeah, they don't treat their pain
yeah,
as something
so, as
wrong.
such, and then it is found that recently in the BBC research that black men are given induction lesser
lesser
compared
than-
to the Caucasian counterpart.
Which
So that is also established, and this is December
So,
2025.
in big
That's was
2025.
established. So I mean,
It's just sad.
so all around the informed consent, I guess. I don't know the way forward, but we'll get back to your research study
What?
when the result comes out. Remember to share.
Oh,
with
is
us.
it the
Yeah.
why people don't? I mean, these are the reasons.
Yeah,
We've already talked
it's a
about
paper I
the
would
reasons.
really love to read.
Yeah.
So thank you so much, everyone, again
Thank
on
you.
another beautiful episode.
Thank you very much.
Also, remember, do not forget to share to your loved ones.
Yeah. Subscribe, like, turn on the notification buttons.
Yeah.
And another thing for you to note is stay informed, stay empowered.
And remember, your health is your wealth. Thank you very much. Bye bye.